Welcome to the beginning of the term. As we continue to navigate the COVID-19 pandemic, we remain committed to advancing students towards graduation safely, in compliance with accreditation and campus safety standards, and with an unwavering commitment to excellence in teaching, learning, and technology. We are excited to share that beginning this term across all of our campuses, we are safely increasing student access to hands-on learning opportunities, including weekly lab learning sessions for our physical and occupational therapy residential students, up to 6 lab learning sessions for our flex students over the semester, wet lab sessions in our cadaver labs, residencies throughout the term for our speech-language pathology and nursing students. We're also adding a regular schedule of supervised open lab sessions to provide our students with additional opportunities to reinforce, practice, and apply lab skills. We continue to monitor federal and local COVID-19 policies, but have adopted our own campus protocols that are designed to keep our entire community safe and healthy while students learn the skills needed to advance towards graduation, and most importantly, become skilled and confident clinicians. University of St. Augustine for Health Sciences is renowned for its highly effective approach to teaching and learning. In this video, we will highlight the features of our immersive and interactive blended learning environment, which combines online instruction, including virtual hands-on labs and simulated telehealth experiences, with face-to-face hands-on learning in our modern state-of-the-art campuses. Our network of more than 600 faculty across 5 campuses works closely together to develop course plans, labs, media, simulations, and assignments. Your online courses contain the collective expertise and regional practice perspectives of this unparalleled national faculty network. We create all of our own course videos, including faculty lectures, demonstration videos, simulations, and interactive learning experiences in-house with our talented and diverse faculty. A team of professional instructional and media designers work with faculty to design learning experiences that are active, immersive, and research-based. That is, we use the most current research and best practices related to virtual learning to guide how we develop our courses, lab sessions, and simulations. This blended learning model combines the many benefits of virtual learning with the best hands-on learning. Let's take a look at how this works.
Your portal to virtual learning is your Blackboard course. This is where you'll find the materials, tools, and resources for each of your courses. Your courses feature digital lecture content, media, collaboration tools, lab plans, and forums for discussion and reflection. Hands-on labs are an important part of your clinical skills development. While you'll be coming to campus for lab activities, there will also be opportunities to prepare, practice, and reinforce these lab skills virtually. We've created innovative approaches to support you with your combined virtual and campus lab learning plans. In addition to your regularly scheduled campus lab sessions, some courses will also have virtual lab experiences that combine lab demonstrations, live video interactions, and immersive simulations, supplemented by digital resources from our university libraries. Through the use of two-way video and group breakout sessions, virtual labs will allow you to observe practice and receive faculty feedback, much like you do in your physical classroom setting. Your virtual lab experience will be enhanced if you have someone available to be your patient. This person can be a family member or a friend with whom you can practice while social distancing or wearing PPE during your interactions. Having a patient will allow you to practice immediately after the faculty demo and receive feedback. Also remember, even when you're learning from home, maintain your professional image as a USAHS student. Always turn your camera on for live class meetings, and when on camera, be sure you have good audio and lighting and an appropriate background. And as always, dress and act professionally, just like you would on campus. In some courses, you will use video to record and document your supplemental lab activities, either through live streaming or recording. Faculty and peers will be able to give you feedback so that you can repeat, iterate, and advance your skills. A powerful advantage of this approach is that you'll be able to review your own video and self-assess, making you a more observant participant and competent practitioner.
Depending on your term and course, immersive and interactive simulations will be used to reinforce clinical skills, while expanding your telehealth proficiencies and preparing you for the future of healthcare in a changing world. Simulations may be scheduled in our Centers for Innovative Clinical Practice in small groups, and many courses also offer virtual simulations. Campus-based simulations involve students interacting in dedicated spaces that mimic real clinical environments, such as an acute care hospital. Students are able to practice their clinical skills with real equipment and mock patients while receiving feedback in a safe learning environment. Virtual simulations are patient cases representing authentic clinical environments, supported by video, where you will make clinical decisions in simulated practice areas and then reflect and debrief with your peers. We even offer an interactive online vSim program, available to all students across the university, that features interprofessional virtual telesimulations with an emphasis on interprofessional education, cultural responsiveness, and patient safety. Simulation exercises help to hone your clinical decision-making, professional communication, critical thinking, and problem-solving skills. They help you develop confidence in your clinical abilities before you work with actual patients in clinical or fieldwork settings. For this reason, simulation is a big part of our innovative learning approach. And by participating in campus-based and virtual simulations, you also become comfortable with essential skills related to telehealth, which is undeniably a critical skill for future clinicians in a rapidly changing healthcare landscape. We proudly prepare you for the future.
We are excited to be able to increase opportunities for our students to safely learn hands-on skills on campus in our labs. However, in order to keep our community safe, we are still following specific policies and procedures which are available on our website at www.usa.edu/return to campus. As guidance may change throughout the term, be sure to visit this page for updates and campus entry instructions. On-campus labs will be conducted like any other lab, but with a few important modifications. First, lab schedules have been arranged to maximize your time on campus while ensuring social distancing guidelines are met, as well as time for routine sanitation of classrooms and common spaces between sessions. Lab sessions on campus will be conducted in small groups led by faculty with expertise in the coursework. Typically, in a lab session, your faculty demonstrates skills that require specialized equipment or more robust in-person explanation. Students are then able to practice with classmates while using the specialized equipment and receiving immediate feedback. Second, PPE, or personal protective equipment, is required to be worn at all times by students and faculty in the lab learning environment and while on campus. As a health sciences university, we are a community deeply committed to health, wellness, and safety. PPE is an important part of keeping our community safe and healthy while COVID-19 remains a global pandemic. Finally, between lab sessions, our classrooms are routinely sanitized and deep cleaned. For this reason, lab sessions are carefully scheduled to allow for cleaning time, and students should only be on campus during their scheduled times. Common areas such as the library, group study areas, and break rooms will remain closed until further notice. We look forward to continuing to gradually increase campus access. Your safety and health remain a priority for us.
The mission of the University of St. Augustine for Health Sciences is the development of professional healthcare practitioners. As a USAHS student, you are the heart of our mission. What you do matters. Stay healthy, be healthy, and model the behaviors and values that will enable our global healthcare community to continue to respond to the COVID-19 pandemic. We look forward to advancing your academic journey to becoming an exceptional healthcare practitioner.